you already got bandages on the hands from some other injury. I like that they're totally taped up. So you got to go like old school granny style, like the bowl. Oh, I love it. Gonna cause a little bit of head trauma, concussion, that sort of thing. Plus or minus a CT scan, or you're just gonna have to be watched by your family to make sure that there's no change in behavior, nausea, vomiting, or being altered. I love bowling. I love it. But at least they're having a lot of fun. Oh, no! That is awesome. The creativity is ridiculous. Man, I didn't know they were so destructive. That's crazy. Oh, the other one. What's gonna happen? What's he doing? Whoa. The question is, will the parts be back in the way that they should, or will it be a mix? Uh-oh. I knew it! Look at the proud doc. Uh-oh, got a problem. Yep. Not so good. Oh, nice. Pull the steri strip and, oh, it's not a steri strip. So there you go. So the bird pulled on suture material. Typically that doesn't happen. That is a continuous running stitch that the moose did. Your sutures should be tied well. You knot it up so it shouldn't just like come right apart. And the fact that all the organs just went everywhere, ridiculous. Oh no, we know where this is going. Okay, slicing the line. A nail. Busted nail. Oh man, come on. You're gonna have maxillary injuries. The nose is gone, right? The first part of the nose is cartilage. Soft tissue is gone at least. Teeth are gone. The mandible is probably fractured. What the? Oh, and then you put some lemons right into the, that's gonna burn if it doesn't already hurt already. Oh, it stings. At least maybe, is it getting clean? Probably not. Probably dirty because bacteria in somebody else's mouth. Now the question is, if you can find the piece, if it's all whole, it might have enough vasculature in that tissue that you can just put it back on and it actually might take. Oh my gosh. Go to the hospital. There goes your finger. Oh, not again.
Huh?
Oh man, right to the side of the head. Gotta be careful. The side of your head has something called the middle meningeal artery on the other side of the skull next to your brain. That could bleed and that can cause a bad epidural hematoma, and then you get a lucid interval and then you could potentially die. Gotta be really, really careful. The eyeball doesn't fall out like that normally, okay? The eyeball is attached by 6 muscles plus your optic nerve. It's not moving. Oh, nice. Gonna slice the eyeball right open. Oh, gross. I love the depiction. It doesn't look like that at all. The eye is super highly specialized tissue and it's mostly liquid. There's the vitreous and the aqueous. It's all fluid, but it keeps the structure of the eye, that sort of thing. Depiction looks like a piece of fruit. The eyeball doesn't look like that. Oh my gosh, come on. You got bloody lemonade. It's so gross. Please don't drink that. Please don't drink that. Please don't drink that. Oh, gross. Blood does not taste good. If you've had a bloody nose or anything like that, it's like metallic-y, gross. That's gonna make you vomit. It's like noxious to your body. Ugh. Oh, look at it. It looks like a little pineapple wedge. Disgusting. All right, where are we at? Washing the hands. Okay, we got good hygiene. No gloves. Okay. Just get a new box, man. Just get a new box. Oh, that's disgusting. So that's supposed to be like a biohazard symbol, like things that are soaked in bodily fluids. Yeah, bad. Careful, you'll stab yourself. Oh, there's organs now too. Oh my gosh. Happy, dirty, disgusting glove. Wash it, man. Dude, I don't know what you're doing. Oh, you're going to the eye. Oh my gosh. Oh my gosh. A lot of times people will actually come into the ER with either like a broken contact lens or they can't find it. Nice thing, we can stain the eye itself so we can actually see the contact a lot easier. 360 degrees, right? And it can kind of sneak in the back a little bit. And we can just take them out pretty easily. Perfect. You got a good contact in. Nice. You gotta really be careful of like corneal abrasions, that sort of thing. Corneal ulcers hurt like hell. Usually it's treated with pain medications and topical ointments, and they feel much better. And yes, we always wear brand new clean gloves. Oh, nice. Full body decimation. So there are people that go around the hospital trying to cheer people up. There's a hospital I used to work at, had the best, coolest Bernese Mountain Dog that would just roam around, was super loving, and always make people feel better. It's awesome that this hospital is trying to make people feel better with maybe a mime. Definitely a mime. Oh no. Oh, it's stuck in the fan? What is happening? Oh! Oh man, snapped a bone in the leg. That's awful. I mean, what's the bandages for if it's not keeping things in place? Oh no, oh no. Oh. Alcohol. So I'm assuming that's alcohol. Alcohol burns. You're trying to clean the wound. Hydrogen peroxide doesn't burn the wound, and it actually helps break down like blood clots. It's good for cleaning the wound in the first 24 hours. After that, because it cleans good cells and bad cells, it inhibits wound healing. You gotta stabilize it. There you go. Put it back together. Woo! Call the doctor. Put a splint on it. Oh, cut it. Cut it. It's just come right off. Oh my gosh. It's like a deer in headlights. Like, what are you doing, mime? Like, stop the machine. Like, help. I've seen a lot of injuries, not like fan injuries, but like saw injuries where people's limbs are like sliced off. Never like this. This is like sliced off in sections, almost like a CAT scan machine. Look like every centimeter a piece is being sliced off, and now we're having like these wheels of tissue everywhere. What the? Yep, a little PTSD. Whoa. What? You're getting a slice through the neck. You're having major blood vessels in the neck. You have your internal and external carotid arteries are still in your neck. You have your jugular veins. It bleeds a lot if you miss or if you poke holes in it. You're slicing it open. You're gonna die pretty fast, especially if you're going both sides. Now, could you take a knife and slice through the bone? Unless you're Rambo, probably not. Oh, he's got a, oh my gosh. Oh my gosh. Let's just throw a grenade inside and the body explodes and he is parachuting down. Maybe free falling. Huh? Hopefully he's got a parachute. Oh, he's going from plane to plane. What? He just grabbed the propeller with his bare hands? Yeah, unlikely. He's gonna slice his own hands off. Come on, and then the strength to rip it off. The thing's flying through the air. It's gotta have the structure to stay on to withstand a lot of wind and a lot of force. So it's just not being ripped off by some crazed psychopath over here. Oh my gosh, this guy is like mass destruction. We'll take a pause for a second. The eyeballs came out, but they're still attached because they're attached by all the muscles and the nerve. Very good job. Oh, so cool. That was awesome. Now you just have the skin, which the skin is the largest organ of our body, is still stuck on the airplane. Look at this person. Oh, he does have a parachute. See? Safe landing. That is crazy. Oh my gosh, like alter ego. Oh, it's like an amusement ride and he just went nuts. Nice. Candy coin machine. I don't know if they have these anymore. I don't know how sanitary they are, so to speak. Do you even know what this is? Let me know in the comments. Oh, there you go. Now you got to be careful not to eat any shards of glass because they'll cause significant laceration in your mouth. Once they get into your stomach and your intestines, if they're small enough, they actually probably won't cause a laceration. Oh, jeez. We get a lot of people that come to the emergency department swallowing foreign objects, screws, nails. If it is in the stomach and it's too large to pass through the intestines, a gastroenterologist will actually come into the hospital. You'll be admitted and you'll have an upper endoscopy done to grab it out of there so it doesn't cause a bowel perforation. Oh! Ah! A lot of broken teeth. We call those like dental fractures. If the tooth comes totally out and you have the tooth, we can put it back in place if it's within 90 minutes. If it's just a chip, we can just cover it with the different types of epoxy so it doesn't cause laceration. Come on. Oh. Don't know where all his teeth have gone. If you can find the teeth and they still have the root in them, you want to either put it in milk, Hank's balanced salt solution, or just in your mouth and bring it to the hospital. Oh, look at this. Appropriate laceration repair. You have suture, which is like the nylon material, or it could be of the absorbable kind, versus Steri-Strips, very sticky type of material that can approximate wound edges. Oh, stop, drop, and roll. Don't be running around like that. You can even use that carpet / rug that's there. Somebody rolls that around you to just smother the fire. That's good. See, somebody wrapped the tablecloth. Oh, stop screaming. The screaming is going to bring the flames into your mouth, which is going to burn your mucosa, which then you're going to potentially have swelling of your airway, and then your airway is going to close. Just open the doorknob. Oh my gosh. An axe to the head. We do see these occasionally. They usually cause blunt trauma with a laceration to the superficial tissue, skull fractures, and they get wedged in just like they would with a piece of wood. Now, if that does happen, don't take it out. Get to the hospital ASAP, and then they'll take it out there. Oh my gosh, come on, the ladder falling and splitting the body. Very interesting. We're seeing like the brain tissue, super cool. A couple teeth. You see the tongue. Oh no, the gas gauge. Just siphon and put gasoline on the fire. What was that?
What the hell was that?
That just went through the back of his head, taking the brains out. Do we have that much blood pouring out the back of our head if it actually opens up? Not that much. It actually does have blood, usually related to a little bit around the brain, and then also the skin, the muscle, the fat. Yep, there you go. So there's something bad within there. Oh my gosh. It's gonna be something straight into the head. Yep, foreign body into the eye itself. Don't remove it, leave it, stabilize it, get somebody to the hospital. You'll have some bleeding.
We got a bleeder!
But if you remove it, you're gonna lose all of the fluid in the eye and it's gonna drain out super fast. And you need to see an ophthalmologist to fix the defect and make sure that you don't have any major structural injuries. Oh, a little mouth to mouth. Oh my gosh. Oh my gosh. If you're doing rescue ventilations on an individual, it's not just going in the lungs, it also could be going down the esophagus into the stomach, causing gastric distension, and the belly just gets huge and big. So when we end up intubating somebody, we actually put a tube into somebody's stomach so you can actually decompress it. Oh my gosh. So people will come into the emergency department and say, hey, I'm going to explode.
I feel like I'm gonna explode here!
I've seen some really distended intestines in my life and they haven't exploded. Trying to do the look, listen, and feel. See if somebody is breathing. So you look to see if their chest is rising. You put your ear and your cheek to the side of their mouth to see if you can feel air movement or hear air movement. When people come in with visual changes, we ask if you're having double vision versus blurry vision. Typically, if it's two images,
I'm seeing double here.
that means your eyes are just not working together, versus blurry vision, there's other factors that are involved. Oh, bleeding out of the ears. When somebody bleeds out of the ears, you think about ruptured tympanic membranes, aka the eardrum, and then you always worry about something even worse where you're having like brain bleeding. Take the headphones off if it's too loud. No.
Nope.
Too loud a volume of music to your ears is going to cause ear trauma, damage. Damage to the receptors, to the nerve endings. Is it going to cause you to explode? No. Could it cause enough pain to your ears? Yes. Holy cow, what the heck? The heart looks pretty good. I mean, the vessels are kind of wonky and all over the place. They don't really look like that on the outside of the heart. Did a good job of the other attachments. Oh my gosh, try to shove it back in. Oh, we got kidneys. We got a kidney that maybe looks like a stomach. I don't know what the white looking potato organ looking thing is supposed to be. Got the heart coming back out. What a bad mattress. That's all I gotta say. Lasted a couple seconds without the organs in the body. Just what I said. They did a good job, at least on that. Oh my gosh, that looked disgusting. It's either sewage coming up, bad diarrhea, I don't know. Sometimes if people vomit a lot, you can get the bile to come out. And some people's bile is green, some is yellow, some is brown. Just depends on the individual. Sometimes when you're hyperventilating, you're blowing off way too much CO2. The point of the bag is actually to keep some of that around to rebreathe it. Otherwise, you're gonna either pass out or you're gonna cause a significant amount of muscle cramping and spasming. Oh, so gross. That's not how you use a plunger. There's actually this type of mechanism in the United States called a Lucas. Basically, it's a device that actually has a plunger suction cup that compresses down onto the chest, and the machine actually will do the CPR for you. Or a bird. Oh my gosh. We got some gluteus maximus.
Maybe just one glute?
Muscle striations that you can see. All different types of glute muscle tissue. Bite wound from an animal, you're definitely going to cover with antibiotics. Typically, we use Augmentin here in the United States, which is amoxicillin and clavulanic acid. Oh my gosh. Ripping of the forearm. What? Oh, the skin just came off. That is a total body degloving. Removal of the skin. Depends if it's a thick enough removal and total removal of the skin. Means it still has its own blood supply. So there's a potential that you can reposition it, put it back in, sew it back together, and it reattach it. We actually get fishing hook injuries that come to the emergency department. It has that barb on the end. So say it goes through the tissue, it's really hard to pull it back. So a lot of times actually it would be easier for us to cut off the either end and push it all the way through. Oh! You're hitting the artery. So there's two major arteries that we worry about further down distally in the wrist that are easily accessible. You have the radial and then the ulnar. They go on either side, right? They correlate to the bone of the wrist. Oh no! Oh! All the blood vessels got pulled out, really creative, and my brain goes directly to these really cool anatomy museums. They literally have all the blood vessels of the body separated in this like container of water in a structure of the body. It is so cool.
Very cool stuff.
Holy cow, oh my gosh, okay. Could you actually pull blood vessels out? You might be able to pull one and stretch it out a little bit. It actually would be probably more white than anything because of the tissue that it is, white and maybe a little bit of red. Oh, the bandits. Oh my gosh, remember these TVs? Holy cow. I don't know if it's a tube TV or not, but the tube TVs are super heavy compared to the flat screens that we have today. Oh, PTSD coming in. People who actually have PTSD are ravaged with flashbacks and depression, anxiety, very physical response of like sweating, tachycardia, feeling like they're going to die. Not good. This response is more of aggression. Sometimes people go to sadness and depression. So there are many different types of responses. I think it's quite appropriate to talk to somebody about these responses and potentially go on medications for a short period of time. Whoa. sometimes your adrenaline can kick in and you can have much more strength than you'd expect. We actually have people that come to the emergency department that are so freaking strong that it takes multiple people to hold them down. Oh, different weight. Okay, fancy, smart. Awful.
That's awful.
Amputation of the arm itself. We talked about how to put a tourniquet on. Use whatever you can to decrease the blood flow that is running out of the body. You have to make sure that you don't lose a large amount of your blood volume because that might not be sustainable with life. The bleeding has stopped. We see a piece of the humerus, I will say, which is single bone of the upper extremity, hanging out there. Most of the time, you actually rongeur it or cut the bone down and have the tissue that you have left to pull over top of it. Oh. Disembowelment and bleeding and lacerations to the abdomen. I've discussed that in previous videos, that the intestines are not just one big string attached to nothing. They're attached to the mesentery that is in there that keeps it connected and having all the blood flow to the intestines. Oh my, what? Oh my word. Typically we do skin transplants with our own skin versus somebody else's skin. There's also synthetic skin out there that you can also use. I mean, if it gripped that well, you'd win every prize. Crazy. So ripping through the ribs, the heart looks pretty good. You got the blood vessels on the outside and the big major blood vessels. You know, your pulmonary branches and then the aorta branch. Very cool.
Cool.
Oh, it started the beat. Sometimes the heart has its own impulses that still have electrical function for a very short period of time after it's been removed. Very cool. It will eventually stop. Ooh, I'm hungry. Give me a sandwich. Don't give the dogs. Okay. Oh, bad spray in the eye. Oh my gosh. Look at the inflammation. So good. Good job, Happy Tree Friend creators. This is something called chemosis, inflammation of the tissue around the eye and within the eye itself, which is quite disturbing for people, but it's actually not bad. It's your normal reaction. If you get something in your eye like this, head to your local ER if you need to, or an eye wash station. It has 2 spigots. You just put your eyes over top of it and you wash it out for like 10, 15 minutes. Yes, it hurts, but you got to get it done. You got to get these chemicals out of your eyes. Oh. Oh my gosh. That is not a nice tortoise. Tortoise versus turtle. Sometimes turtles harbor salmonella, so just be careful. Don't go licking turtles out there. Salmonella typically will cause GI symptoms, nausea, vomiting, and a lot of diarrhea and upset stomach.
Aww.
Oh, we're shrinking up. Nice. Oh, it's going to be shrinking too much and she's going to pop. I know it. Compression of the airway, compression down of the thoracic cavity. You're going to be breaking your ribs. You're going to cause your ribs to stab into your lungs, which then will actually collapse your lungs and pop them that way.
Pop, pop, pop.
Your head typically is not going to pop off, but you're going to have decreased blood flow to all of your vital organs, and you will potentially die. Oh, the cannonball shot. Oh! Whoa, oh my gosh! Again, the intestines are attached to mesentery. When we open somebody up and we're looking to see if there's like a twisting of the intestines, you actually have to kind of feed it through itself. Sometimes it's twisted because of the mesentery. The amount of trampoline injuries that I've seen typically are related to people falling off them or breaking an arm or a leg or an ankle or a wrist due to twisting it or landing right on it. Oh, flying. And that's a first for me, seeing the intestines lacerate somebody so bad that it cuts them in half. But again, if you have enough speed and something is hard enough, it could potentially happen. geez, we got some plumber action. In medicine, we actually have devices that are like plungers. The one that we use most in the hospital I'm at is called the Lucas, used for CPR. It sits right on somebody's chest and it compresses down and it does the chest compressions for you at the exact depth that you want, at the right speed and time. Oh, nice. Okay. An arrow won't work, but it might poke whatever is there to break it up. Oh my gosh! We do see people get foreign bodies into their rectum and it will stay within the intestines themselves, meaning it'll stay in the large intestine. Unless it's an abnormal shape or too large, you should be able to poop it back out. Whoa, we got brain matter flying out. It does kind of look like that. It's soft. It has a different smell. It's white gray-ish. Bad news bears when that stuff's coming out. Oh my gosh! You rupture the globe of the eye. You poke a hole through any part of the eye, but this is the white part of the eye. We call this sclera. The issue ends up being you can sew that back up. You're probably gonna need some antibiotics because of potential of being dirty. You might need to have your tetanus shot up to date. Oh! Straight through the ear to the other side. I do joke sometimes with patients when I look at one ear, I'm like, oh, I can see through the other side. But you can't.
You can't.
You're seeing the tympanic membrane and you stop. You can see like a shadow a little bit. This is the most heinous scene. Oh my gosh. Gotta be careful about those metal gates. Come down and slice a body in half. It's a barber shop. We got the different colors because barbers used to be into like bloodletting back in the day. Oh geez. Oh no. Whoa, 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 whoa. Why are they so swollen? We get people who do come into the emergency department swollen. Usually it's due to an allergic reaction, right? That's the easiest thing you think of. Somebody who's in congestive heart failure, they get something called peripheral edema, where the fluid just gets into the tissue. Oh, okay. We got some radiation exposure. Not much to do if somebody's exposed to radiation versus supportive therapy, managing the hydration, managing the airway, all the after effects of the exposure. Oh. Oh man, why would you blow it into the air? Why wouldn't you appropriately dispose of it? So you can have all different ways that exposure could affect the body. And if it's topical, obviously it's just melting away the skin. And it would definitely be on the mucous membranes, might be sloughing off and then getting into the GI tract as well as the lungs due to the fact it was inhaled and maybe swallowed or ingested. Oh, there you go. We got some vomiting out the nose. Who out there has ever vomited out the nose? Please, I want to know in the comments. It happens. It's not comfortable. Oh my gosh. It's gonna pop. I feel like I need to like take a chill pill and calm down a little bit because this was so intense. If you guys feel the same way, you definitely check out Chillax by Life Happens, my company. Oi. People always ask, can you pop? Are your intestines gonna pop? They actually do stretch. At some point you may pop, but it does take a while. Oh, cool. Oh, controlling. Oh, that's messed up. Controlling the robot remotely. Getting electrocuted. Common occurrence that comes to the emergency department. Typically, it's very minimal energy versus like big energy like lightning or power lines. Most of the time, we're just seeing like simple burns and injuries. Oh my gosh, yeah, this would be horrific. Razor blade. We have patients that come into the emergency department that say they swallowed razor blades, but no, they typically swallow small little pieces. This would cause lacerations, a perforated bowel, increased risk of death. Oh! Oh my gosh, the teeth! What are you doing? What are you doing? Okay, paper shredder. Oh. The tongue bleeds so much when there's an injury to a tongue, even if you bite it. Most of the time, you don't necessarily need to like sew it back together if it's a simple laceration. But if it's like a huge chunk that's missing, then yes, you need to try to sew it back together. Numbing it is difficult.
You got numb tongue?
Oh my gosh! There goes your taste buds. What is this? What is this? Oh my gosh, you're gonna nail your own tail. Ow! I've seen plenty of people get nail hammer injuries.
Hammer time!
Sometimes we can take them out easily. Sometimes they're not as easy. I had people come in with wood attached with the nail or the staple or whatever to their body part. We gotta pull that apart. What? Oh my gosh, it's like a propeller. I don't know if you guys seen the video that Jen and I did with like first aid and using a tourniquet. This is a technique that you would use to tighten the tourniquet, but now your own tongue. Oh my gosh. We got brain attached to tongue, obviously a little off, but different anatomy. And we actually have some organs coming after the thoracic cavity and the ribs. Very impressive. Oh, just chilling on a log. Oh gosh, get off the wood. Okay. Oh, well, that character is now gone. Okay, I was able to stop. We see the brains, all mush, appropriate depiction of it. Normal appearing white matter and gray matter-ish. There's not really any gray there that we can see, but good job. This is awful. Wow, it is busting through the skin. You're seeing the knee right there. You actually see a joint. So you have your femur, and then the femur actually sits on top of, at the joint, the tibia. What's gonna happen? Oh gosh, oh gosh. Oh man, that leg's now coming off. And the worst road rash ever. So we get people who like ride motorcycles in Southern California, and people will fall and slide and slide and slide. They're gonna need multiple screen grafts to basically repair all the burned tissue. Whoa, check out those blood vessels of the eye. People will come in with like ruptured blood vessels of the eye, and it looks super scary when you come in. It's called a subconjunctival hemorrhage or hematoma. And it's okay, it'll go away. But it just looks really, really bad and scary. Oh my gosh. Wow, what would you do? If you randomly saw a pair of eyeballs where they shouldn't be? I don't know, I'd kind of, not freak out, I'm an ER doctor, but I'd just be like, where the heck did these just come from? Oh no. Oh my. You do see the brain and you see the gyrate, the funny little zigzags of the brain itself. You see multiple layers of the scalp and the skin and the skull, but the eyeballs are out here. They're outside of the bone. Whoa, 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 whoa. Taking off the anterior part of the face. Obviously, we have the eyeballs coming out. If they're coming out like a string like that, that is probably the optic nerve that is still attached. We have 6 muscles that attach to the eye. Oh, nothing like being boiled. Flushes this boiled off. Could something be that hot? Yes, potentially. It'd probably take a little bit longer. The muscles that are supposed to be doing all the movements aren't there, so you wouldn't be able to move the skeleton like that. Falling from great heights. In the emergency department, we worry about anybody that falls greater than 3 times their height. Roughly about 15 feet or so, maybe a little bit more. The superhero here probably just caused a massive lumbar or thoracic fracture, maybe making this creature paralyzed. Speed at which you're flying just ripped your eyeballs out.
My eyeballs could have been sucked from their sockets.
Could this happen? Probably not. But when people do jump out of airplanes, you do wear eye protection because obviously you don't want to get something in your eye, drying out your eyes as well, causing a lot of pain and discomfort in the future. Oh my gosh, the face is peeling off. We have so many different muscles of the face, and they actually go in different directions, and it has to do with how the muscles move. Oh my gosh. I've been in situations where I've had to take care of individuals in the emergency department where they've actually had significant brain injuries because of literally being in a bicycle. And I've seen lots of broken bones. Be safe, please. Oh, we got rubber on fire. We're flying through the air. Not wearing a helmet, just so we all know. Oh gosh. Oh, I knew that was coming. I knew that was gonna happen. Significant amount of rectal trauma that occurs. Ouch, there are a lot of blood vessels in that area. There's a lot of what we call hemorrhoidal tissue that helps prevent infections. Oh, the road rash on the face. Sometimes when the road rash is so bad, it may not heal and you actually need to have a skin graft and it's treated like a burn. Oh, we got the string intestines, my favorite. The intestines, yes, they are a long string of muscle, but they are attached by the mesentery, which provides all the blood vessels to the intestines, and they are in a big ball. Oh, we're backpedaling it. Okay. Can you live without some of your intestines? Absolutely. You can remove most of your small intestine. You can remove almost all of your colon. Sometimes people have ulcerative colitis, and one of the definitive treatments they used to use is removal of the colon. Falling objects out of the sky literally could cause massive trauma and injury, so please be careful when you're leaning over the ledge of a tall building. Don't stick your phone out. It can drop and actually kill somebody. Oh, we got a ramp. Nice. Oh! Who's allergic to bees? Let me know in the comments. Hopefully anybody out there has an allergy to bee stings that you carry an EpiPen with you. Make sure it's not expired. Make sure you have an extra one. Make sure you keep it on you. Okay, that looks like at least the honey that's coming out. But what happened? Oh. Holy cow, those are probably like murder hornets versus honeybees. Once you start getting stung multiple times, your body's just continually being overstimulated and overdriving, and it's going to have a massive response, and that's when you have a significant increased risk of death due to anaphylaxis in these situations. Oh, what? Typically, these type of accidents do occur, but more in a high velocity car accident when this would occur. The individual, if they're in pieces, obviously does not make it to the emergency department. A little pine cone. Why would we block the exhaust? Oh, maybe because I wanted to hit my friend. Most of the time we hear about like exhaust causing like carbon monoxide poisoning. Carbon monoxide displaces the oxygen off of the heme groups relating to your hemoglobin on your red blood cells, which have to do with your oxygen carrying capacity. Oh my gosh, so tying themselves to a tree to prevent it from being cut down and cutting down a different tree. Oh my gosh, getting another person's blood splattered all over you. Nope, not something you want to be in a situation of. Most people do not have bloodborne pathogens, but you don't know. Oh my gosh, I'm surprised he's not impaled. Why does he have so much dynamite? Car accidents where people get trapped and the fire department needs to use like the jaws of life, different machines to actually like cut through. I've seen people actually, when they're released from this position, actually end up dying because they're being compressed in such a way that it's preventing the injury from actually finishing.
Finish him.
Oh no. Just blew open the dam. Oh my gosh. The toilet seat wrapped around your neck, increasing the risk of airway compromise, fracturing your hyoid bone, which is the only bone of the neck itself in the front here, versus the rest of it is cartilage. Holy cow, this looks like somebody just speared straight through the body. Heart anatomy looks pretty darn good.
Pretty darn good.
We got major vessels coming off. Typically, you wouldn't see the intestines into the thoracic cavity unless there was a rupture of the diaphragm, coughing, cough out blood, and succumb to the injuries because your heart's not there. So it lived a little bit longer after the heart was removed, which again is a little bit more realistic, which is pretty good. Oh, a little stand. Okay. Oh my gosh. Okay, a dumpster. I gotta tell you guys a funny story. One time, I thought I threw my keys in a dumpster, keys to my car. I jumped in the dumpster, tried to search everywhere for the keys, couldn't find them. Ultimately, got a new set of keys made at the car dealership, opened the cupboard, got a glass, and the keys were sitting right there. Uh-oh. Oh, no. This literally has... Are you kidding me? Would the spine break through the skin like that? Hard to know. That the skin of the back is really, really thick.
Pretty thick.
The bones, the vertebrae of the back aren't necessarily that sharp. Oh my gosh, I hate this thing. I am not a fan of things that make you go spinny and lose your equilibrium and feel like you're going to fall down. Nope, I'm good. Oh gosh. Okay, I mean, I can handle it if it's going that slow. Yeah, everybody's great. I 100% think merry-go-rounds are very dangerous.
Merry-go-round.
People fall, trip, they can break something really easy. A lot of head injuries could occur, and even getting stuck underneath. Just make sure if you're going to play with these that you are aware, supervised, or you're doing the supervision to make sure nobody gets hurt. Oh! Oh my gosh. Yep. Oh my gosh. Happy Tree Friends, it's really funny. Every time they cut or show a slice of an individual, they always looks like a piece of ham.
Ham!
Whoa! And insult to injury. Typically don't see that type of impalement as often as you would think. Typically when we see somebody who gets hit by something metal, it's usually blunt trauma versus penetrating trauma like that. Oh my god. Holy cow. It would take a lot of force to be able to do that because you have to rip through all the tissue, not just the joints. You need to separate the joints.
You gotta keep them separated.
Which are the ligaments, and then you have your tendon attachments of the muscles. So a lot of things need to be ripped and pulled. Oh. Why is there a random plane close to the playground for kids? Again, not compatible with life. Again, doesn't come to the emergency department. Oh my gosh, the moose. Bilateral upper extremity amputations at the elbow. Could you live with that? Is that compatible? Yes. The difficult part is there's nothing to grasp. You have to use your axilla, aka the armpit, to be able to grasp things. Oh, swing set. I like the swing set. You get to swing as high as possible, and then I would jump off. Please be careful if you do that, and don't swing it all the way around because you're gonna hurt yourself. Oh, jeez. Oh my gosh. Pipe straight through the skull into the brain, right? You wouldn't have that happen, but if the edge of that sharp pipe got through, you could potentially cause laceration and fracture to the skull itself. And then falling on your coccyx, you increase the risk of a coccyx injury. Coccyx is your tailbone. Potentially brain trauma. The person could be still alive, especially if their brainstem is still intact. And then you'd see some secondary findings of maybe some respiratory difficulty, but still able to breathe. Why would this be, what?
What?
We have puncture wounds here, right? I always say, don't pull it out. But when it comes to this situation, you have to get the person off of this. So you have two choices, pull all the way off or have a device that can cut those pieces of metal and leave them in place. It's like a cheese grater. Have anybody cut their hand or finger on a cheese grater? Awful pain, totally uncomfortable. Be careful. Usually it's like your nails or your tips of your fingers. Why this?
What am I looking at here?
I've worked a full shift today, came home and filmed for you guys. I'm gonna take some of my chillax so I can just take a chill pill, literally. Definitely check out Life Happens if you need to take a little bit of relaxing time to yourself. Whoa. Who loves a unicycle? Is there anybody out there that can actually ride a unicycle? I could ride a unicycle. I bet you didn't know that. Still got the juggling going. Pretty good. Oh my gosh. I'm not a fan of teeth. That's why I'm not a dentist. We don't deal with too much dental emergencies in the emergency department outside of if a tooth is out, broken in half, or really bad infections. Those are our big ones. We'll put the tooth back in if we have it in time. We'll cover up the broken tooth and get you over to the dentist in the next 24 hours. A mouth ruptured open, mucosal tear. So we do see these, the mouth bleeds a lot. Sometimes we do need to do some suturing. Have I ever seen that happen? No, but I have seen people get lip lacerations that they need a plastic surgeon to put things back together. Oh my gosh, the upper lip maxilla component just gone. You're just seeing like the muscles, the striation there. If you're falling that high, the contact with the ground is gonna probably cause you to just go. Get him! We got organs everywhere. I see a random eyeball. I see maybe a kidney. We got brain matter. Typically when somebody falls from that great of a height, yes, brain matter does go flying. Bone pieces and fragments go flying. Most of the time the organs stay within the body itself, but the head kind of, unfortunately, explodes open. Why are we doing this? That's a little bit better. So the intestines are like in a big ball within our abdomen. And depending on how much visceral fat we have or not, depends on how tightly that ball is. But this is actually a pretty good depiction. They must have listened to me before. They must have seen one of my videos. No, I'm just kidding. The blood would be coming from either your inferior vena cava with the main vein in your mid-abdomen or your abdominal aorta, which is the main blood vessel. Oh! Come on. Come on. That will definitely leave a mark. Bruise to the butt. The most common like back end issue is related to like hemorrhoids or a pilonatal cyst, which is so uncomfortable for people. Some people are more at risk for it than others. Oh, but there is a beam. Head injury, black eye, upper and lower eyelids definitely swell a lot. You got to be careful that there's no fracture. If there is a fracture, please do not sneeze. If you do, open your mouth, blow it out. Otherwise, we'll allow air to escape into the sinuses. And then if there's a fracture, we'll go out. Oh my gosh. All the way up into the brain, we see brain matter. But take a look at the eye on the right. You're seeing one attachment. We have 6 muscle attachments plus your optic nerve. So that's probably your optic nerve attached in the middle of the back. Nice. Oh, geez. Okay, first off, who has a pair of crutches at the house? I want to know.
Not even on crutches.
We give out crutches like it's candy in the emergency department. Man, are they a pain to use. You actually really don't want a lot of weight into the armpit because you use something called your brachial plexus, which can actually cause nerve issues relating to your arms. So you actually put more weight on your hands and your wrist. Oh, jeez. Oh! It is not looking like a normal bone that's just in your neck there. That looks like an extremity bone. If your head were to come right off due to trauma, you'd see your vertebrae there. Oh my gosh. Do we have prosthesis for somebody's head? No. Most prosthetics that we have are related to extremities, upper extremity, lower extremity, and they're getting much better. We do transplant organs, obviously. Nice. Tongue stuck on the ice. You're causing freeze burn to that area. It hurts a lot, decreased blood supply to the area, and you can cause superficial injury versus more deeper and long-term injury. Uh-oh, it's gonna rip it. Oh my gosh. Probably want to use some like warm water to help melt the ice so you can get it off there versus if you use cold water, could there potentially just be an injury related to continued freezing. Oh man, rub it. Oh my gosh, nice little cat, and it's gonna. We do see a lot of tongue injuries that end up coming to the emergency department where people will have a laceration. A lot of time, we don't necessarily need to close up those wounds because the mucosal layers within the mouth themselves heal really, really well and really, really fast. Oh! It did a good job of trying to depict the muscle fibers and all those like nice circles. Basically, those are just the groupings of the muscle tissue. And yes, the tongue bleeds a lot. It's so gross. There are incidences where decreasing the body's temperature is actually good. We'll have people that show up to the emergency department, cardiac arrest, and say we get them back. There's been studies and literature that show that cooling the body just a tiny bit actually improves neurologic outcome. Them trying to lift a heavy object, back injuries, muscle spasms. The number one reason why people actually are unable to work is due to back pain and poor body mechanics and not knowing that they can't lift something that heavy. Just the rope burn on your hands just made me feel awful. These are pretty bad degloving injuries that happen in usually car accidents, motorcycle accidents, and degloving meaning the skin rips off and basically the underlying tissue is exposed, bones exposed, those sorts of things. Cats are quite resilient and they do land on their feet most of the time, but they also get very agitated and will scratch. Oh. Oh, another degloving injury, exposure of muscle, lots of blood. Cars are just so dangerous. Well, that just turned into a unique kebab. We got organs everywhere. We got the classic intestines wrapping around. Intestines do look like sausages, but they are all in one piece. They are not one long string of sausage. This is just so gnarly. Stomach, kidney, eyes. We got appropriate vertebrae. There's not much left. Oh my gosh, it's like Noah's Ark. Reminds me of like the medieval times when they're trying to use like the rack. Typically joints will dislocate. You can get bones that fractures and then the skin will eventually rip due to the force. It's like this all the time with Happy Tree Friends characters. But also sometimes in real life, you may feel life's occasional stresses just keep stacking up against you. You could always try the supplement that I created called Chillax by my company Life Happens, designed to help you find calm amongst life's occasional chaos. Okay, first pipe smoke. Please don't do that. No smoking is good smoking. Oh no, we got the classic boombox. I know it's an old school theme. Now, if it's like way too loud and all at once, could you cause your eardrum to rupture, potentially cause bleeding? We see people come to the hospital relating to eardrum trauma, usually related to an infection that bursts open the eardrum itself or the tympanic membrane. Oh, into the sun, you're gonna burn your eyes. The concentration of the energy of the sun, just think about that. How intense the sun is and what we're doing to our skin when we go outside. Please make sure you protect your skin. Oh! Oh, jeez. From the sun causes burns, like literally burns to your skin. 1st degree, 2nd, even occasional 3rd degree burns from some individuals, but usually doesn't get that bad. If you concentrate the light using a different type of lens or a mirror, you can actually cause fires and burns, so please don't do that. We got a submarine. This is like an example of something called like a flailed chest, where actually the whole section is off. Obviously, a flailed chest would still be attached, but the segment actually works in opposite direction. So as you breathe in, it actually go in paradoxical movements. Oh, geez. The volcanoes in the ocean. Oh! Awful. So the heat's so bad that you're just melting. Obviously, we see injuries relating to fires or hot liquids or like stovetops. That's kind of the most common things that we see. Most of the burns that we end up seeing in the hospital is related to hot liquids. So, you know, be careful cooking soups or boiling water, because those are the most common burns that we actually see. Oh man, okay, first off, he's blind, right? So the stick is actually called a mobility cane. They're typically white with a red ending. This is not gonna be good giving a sharp object to the blind guy. Ah, okay. Oh my gosh. How many of you out there have ever dissected a frog? Let me know in the comments. I have. I think it was the first thing I've ever dissected. Oh no. Oh, that's the worst. How many people have had an injury to the foot? It is the worst. Sometimes they bleed like stink, but it's hard to get to it sometimes. Obviously, put pressure on it and actually elevate it. Because it is down, it's just gonna keep pumping. Oh my gosh, oh man. Stuck around the neck, causing asphyxiation, causing decreased blood flow to the brain. Both things can cause you to pass out. Decreasing blood flow to the brain or changing the flow could increase the risk of developing a blood clot, which then can get dislodged and go into the brain, causing a stroke. Bad things can happen. Oh my gosh. Oh my god. Oh. So, I don't know if that's a thing, if there's fishermen out there. Do people use explosives when fishing? We have pieces of the creature just flying everywhere, including half of the head. We got the brain, obviously, the skeleton attached in the sense of we have the vertebrae and we have a single tooth. My classic line, this is definitely not compatible with life.
He's dead, Jim.
Oh, get out. Get out of there. Oh my gosh. Would you trust the moose as your firefighter? Let me know in the comments. Oh, no, electrical. Oh man, fear unlocked right there. Dropping of an elevator. Whew. Come on!
Come on!
Very cool little anatomy we got going on here. We can see the brain, we can see the lungs, and then a bunch of the red stuff. Most of the elevator doors do have safety so they don't get you, as well as there's the inner door versus the outer door. One's actually a part of the elevator, the one is related to the floor that you're actually on. Oh, we got intestines. For all of you followers out there, we know that that string of intestines would be attached by the mesentery and wouldn't necessarily pull apart like that, but it is quite stretchy. Oh, no, 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 no. Oh, man. You can't just be wielding an axe. Broke through the skull, which is pretty hard to do, but there's a big heavy axe and he took a big swing, so that's a great possibility. Right down the center between the two hemispheres. Obviously you're gonna have bleeding, but could the brain be spared? Very interesting. I bet there are case reports out there where people have had brain trauma that went straight through the middle and missed the brain tissue and were able to survive and tell the story. Oh no, you're gonna use that to climb on. Very slimy, very slippery, mucus. When you open up a human for surgery, everything's kind of like wet in there. Everything's moving around and kind of juicy.
Juicy.
One from the burning building. We have charred creatures. When the burn is that bad, it's 3rd versus 4th degree burn and then airway compromise. Why do we have a random kidney? That was really funny. We do see a lot of crush type injuries, but the ones that we typically see are extremity crushes, usually work related versus automobile related. Oh my gosh. The moose is trying to do CPR. Great. Check to make sure they're not awake. Check a pulse, listening for breathing, right? Look, listen, feel. Then, obviously, at the same time, you're calling for somebody to get help, and then you do start compressions. Oh. Looking good. Oh, the genie. I love it. A disco ball. Is that what you would wish for? If you had 3 wishes, let me know in the comments what you would wish for. Oh no. Yep. We have forest fires and injuries. Yeah. Oh, right into the eyes. Reminds me of bad shows where you're getting laser surgery. And can you actually cause eye damage by lasers? Yes, you can. Just depends on multiple different factors. And same idea. The laser pens always says like don't shine into somebody's eyes, can cause retinal damage. Ouch. If you survive a crush injury, besides the crush injury aspect, we do worry about the breakdown of the cells of that area. When you crush cells, you have a higher concentration of potassium, then you actually can cause cardiac arrhythmias. Oh, we got the genie again. Sweet. Oh, you have that great of a grasp on the lamp that they're able to rip your arms off. Crazy. So remember, the forearm has 2 bones in it. It's got your radius and your ulna, versus then the upper part of the arm that's still attached. We have the humerus there. So what would you do?
What would you do?
If an individual had their arms ripped off, you need to stop the bleeding. Direct pressure first. If you can't get it stopped with direct pressure, tourniquets. Don't just jump to the belt right away. See if there's something fabric and that you can twist. If you still have the amputated parts, please bring them with you. Shards of glass flying at you. They're stuck inside. Your first instinct is to grab them and pull them out. Even if they're gonna cause you to have a laceration on your hand, please be careful. Some of these are gonna be super deep and might cause worsening bleeding, and then you're gonna bleed out before you even make it to the hospital system. Oh, little honeybees. Do you know honeybees are so good for our environment? Please take good care of them.
Covered in bees.
Oh. Got honey on the face. Honey is delicious. It's so good. It's actually anti-inflammatory and it helps with people's allergies. I'll just wipe it off. Oh, we got an animal. Oh my gosh. Yep. Knew that was gonna happen. Oh man. Slices. You got the bear claws that went all the way through, but yet the spinal cord still intact. We'll let that go. But it's interesting, when we do CT scans, we do it like that, where they're actually slices. They're typically 5mm slices. So you're actually missing some information. Oh no, they did a good job. They went all the way through, so that's good. If you're like me and you want some calm vibes after watching all these woodland creature catastrophes, I think you should definitely check out Chillax by my company, Life Happens. Check out Chillax at lifehappens.com as well as Amazon. Oh. We talk about this often on this channel, having to do with trauma, falling from great heights, greater than 3 times your own height, greater than 15 feet. But these are massive falls. The survivability of these are super low. They're landing on stones and rocks and getting impaled. There's not much to say there. Okay, obviously, we have a plank into the buttocks.
In the buttocks.
Buttocks is made up of a lot of big muscles, your gluteus maximus. Yes, actually, that is a word. Most likely it's a soft tissue injury, but we always worry about the pelvic bones as well as the femur itself and probably your sacrum and your coccyx. If somebody comes in with this type of impalement, you will make it shorter, probably get some imaging, and then thereafter get it removed. Obviously, pain medication, probably a trauma surgeon will do some anesthetizing around the area to maybe make it feel a little bit better besides regular pain medicine. Oh, we see exposure of bone. That is an open fracture. That's what we call that. Very simple terms. We call it that way because we want to classify, is it closed or open? Is there an increased risk of infection? Poor prognosis, poor outcome. So I think they're doing a good depiction. People try to get close to these nice furry animals, but it's probably not the smartest thing to do. They are still wild animals, and if they feel threatened at all or hungry, they're gonna come after you. Oh, we got a ski slope. We got the classic lift without the safety bar. Just be careful on those, no sudden movement. Oh. Oh my gosh. Oh, come on. Come on! This actually does happen more often than you think. That people come to the emergency department, it goes right through a shoe, and then you worry about the Pseudomonas infection, you worry about puncture wound. Not that far-fetched. When you bleed, if you take a little bit of your blood and put it in a gallon of water, that whole thing's gonna be bright red. So same idea, right? Snow is just water. Oh. Oh, ripped right through the foot. Ouch. Sometimes this can happen pretty easily, especially if the object is going in between the metatarsals, so the bones of the foot. It could rip through. We've seen that before. Typically, as long as the nerves are intact, this can be repaired. Don't just scream, put pressure on it, elevate it, and probably the easiest way is to actually try to close it back up and put pressure on it that way.